Diaper rash is a common concern for parents. It can cause discomfort for babies and worry for caregivers. Understanding the causes, treatments, and prevention of diaper rash can help keep babies happy and healthy. This guide will provide you with the information you need to care for your baby's delicate skin. Diaper rash is a skin irritation that appears in the diaper area. It usually affects babies and young children. The rash can range from mild redness to severe sores. Diaper rash is often caused by prolonged contact with urine and stool. Most diaper rashes clear up with simple home care. This includes frequent diaper changes and using a barrier cream. In some cases, a doctor may recommend medicated creams. Early intervention is key to managing diaper rash effectively. By understanding the causes and implementing preventative measures, you can minimize the risk of your baby developing this uncomfortable condition. Let's explore the world of diaper rash together and empower you to keep your baby's bottom happy and healthy. Diaper rash is an inflammatory skin condition that affects the area covered by a diaper. It is characterized by red, irritated, and sometimes bumpy skin. The rash can vary in severity from mild redness to open sores. The most common cause of diaper rash is prolonged exposure to wetness. Urine and stool contain irritants that can break down the skin's protective barrier. When the skin remains wet for extended periods, it becomes more susceptible to irritation and infection. Other factors that can contribute to diaper rash include friction. Constant rubbing from diapers, especially those that are too tight, can irritate the skin. Yeast infections. Candida albicans, a type of yeast, thrives in warm, moist environments like the diaper area. Allergies. Some babies may develop diaper rash due to allergies to certain diaper materials, wipes, or detergents. Introduction of new foods. Changes in a baby's diet, such as the introduction of solid foods, can alter the composition of their stool, leading to diaper rash. Recognizing the symptoms of diaper rash is crucial for prompt treatment. Look for the following signs. Redness. The affected area may appear bright red or have a reddish-purple hue. Bumps or blisters. Small bumps, blisters, or pimples may develop in the diaper area. Swelling. The skin may appear puffy or swollen. Warmth. The affected area may feel warm to the touch. Fussiness. Your baby may cry or fuss during diaper changes or when the affected area is touched. Choosing the right diaper is essential for preventing and managing diaper rash. Different types of diapers offer varying levels of absorbency, breathability, and fit, all of which can impact the likelihood of diaper rash developing. Disposable diapers are a popular choice due to their convenience. They are designed to absorb large amounts of liquid, keeping the baby's skin dry. When selecting disposable diapers, opt for brands that are free of fragrances, dyes, and lotions, as these additives can irritate sensitive skin. Cloth diapers, a more traditional option, have gained popularity in recent years due to their environmental friendliness. Cloth diapers are reusable and require washing after each use. They are often made from natural, breathable materials like cotton, which can be gentler on a baby's skin. Eco-friendly diapers offer a compromise between disposable and cloth options. These diapers are designed to be biodegradable or compostable, reducing their environmental impact. They often use plant-based materials and are free of harsh chemicals. Regardless of the type of diaper you choose, proper fit is crucial. A diaper that is too tight can cause chafing and irritation, while a diaper that is too loose may leak. Ensure that the diaper fits snugly around the waist and legs without leaving red marks. Treating diaper rash promptly is essential for alleviating your baby's discomfort and preventing the condition from worsening. The primary goal of treatment is to keep the affected area clean, dry, and protected. Frequent diaper changes are the cornerstone of diaper rash treatment. Change your baby's diaper as soon as it becomes wet or soiled. This prevents prolonged contact with urine and stool, which are major irritants. Gentle cleansing is crucial for removing irritants without further irritating the skin. Use warm water and a soft washcloth to clean the diaper area. Avoid harsh soaps or wipes that contain alcohol or fragrances, as these can dry out and irritate the skin. Air drying is an effective way to soothe irritated skin. After cleansing, allow your baby to air dry for a few minutes before putting on a fresh diaper. This allows the skin to breathe and promotes healing. Barrier creams create a protective layer on the skin, preventing further irritation from urine and stool. Look for creams that contain zinc oxide or petroleum jelly, as these ingredients form an effective barrier. Apply a thin layer of barrier cream to the affected area after each diaper change.